If a placebo works on pain, does it mean that the pain isn't real and that it's only psychological? Also, if a placebo takes pain away, wouldn't the placebo effect work with a drug? Now, who's to say if it's the drug or the placebo effect?
That's right.
A new study published in the journal Pediatrics shows that the placebo is as effective as most drugs for kids with migraine headaches. Yet the researchers of the study don't recommend it. They recommend over-the-counter drugs and rest. And study results are written like it's bad news because no drugs have been approved for preventing migraines in kids. What's going on, and why recommend a drug with possible side effects?
Well, Vicki, it's just the way we think. You know, in medicine, we think of drugs. And that's our first and a lot of the time last choice, and we even force it sometimes. And when you've got drugs that don't work, that have lots of side effects, or if they work minimally, you know, there were two drugs that they felt worked pretty well. One was Topamax and the other was trazadone. But those are powerful drugs that have lots of potential side effects. And to prevent just one migraine headache a month, not worth it. The placebo had a lot more effect than that.
And the adult drugs weren't even very effective in the kids.
No. So when you're looking at what to do with kids to try to prevent headaches, the placebo is the treatment of choice, really. And why wouldn't you want to use it? Because
well,
actually
it cuts it in half, doesn't it?
It cuts the number of headaches in half, and it works as well as most of the drugs.
So why is this study result being ignored?
Well, because of the way we think. I mean, doctors and pharmaceutical companies think in terms of drugs. So they're going to force that the best they can, and they'll probably say, well, Topamax and trazodone actually do make it a little bit less of a problem, and that's true. But the question, or the problem is it worth it? And to my way of thinking, I'd use a placebo on the child. The child's not going to know the difference.
Well,
and if it works, it's safe, it's inexpensive, and it works.
Well, there are other things that can be helpful for migraines also.
Oh, lots of things.
You know, there's things like hypnotherapy and massage and chiropractic, because sometimes the headache is from a misalignment.
Absolutely.
From stress, you know, to stress reduction. Sometimes a child is allergic and that would give them a headache, or maybe the diet that they're on. Those things can be changed also. But there's qigong. There's all kinds of things.
We can treat the symptoms by using drugs, or we can treat the symptoms by using a lot of technologies like what you're talking about. And if we choose to do that, we're going to be ahead of the game if it's safe. But if we're going to be using drugs that are potentially toxic, that have all the side effects that you really don't want, I mean, you look at a drug like Topamax, it's an anticonvulsive drug. It's used for people who have seizures.
Why would they give them that? Maybe because some migraines are caused from vascular spasm and they think it'll stop this.
They're caused by vascular changes for sure. But if it was a safe drug, fine. But if you're moving from 15 headaches to 14 headaches a month, I mean, you're not talking about much of a difference. I would say placebo is what to do, but what you're pointing out here, it has to do with the triggers that cause migraine. Can we treat those? Because a lot of people who have headaches that are migraine, they're triggered by muscle spasm in the back of the neck. That's usually caused by trauma to the neck, so that somebody's been in an auto accident or fell off a tree or off of a horse, and they've got a trigger point back there. That can cause the problem to develop. So chiropractic, acupuncture, body work, craniosacral, and lots of other technology.
Stimulator.
Oh, the photon stimulator is a brilliant thing, and you bring up a really good point here, because it's a totally safe, non-invasive approach that's cheap and works. Now, there's not enough research on it, but I've had 13 or 14 years of experience in it. It's very rare for somebody to come to my office who has a headache and walk out with a headache in a 5-minute treatment. And that sounds ridiculous, but it's true in my experience. So there are lots of approaches. Because many times
people that have migraines are rushed to the emergency room and they're given morphine. And then they have to, you know, take a whole day off.
Or maybe 2 or 3 days off. So when we're looking at the treatment of migraine headaches, there are lots of approaches that are making much more sense than the toxic drugs that these studies show don't work any better than placebo. Or if they do work a little bit better, I mean, it's not worth it because it doesn't do that much. And they even say that in the article itself. So there's a lot we can do, Vicki, I think, in treating these kids who have migraine headaches and preventing them from occurring with the frequency that they do.